Hello, my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for the last 25 years and I love it. What are we going to learn today? Okay, so we're going to learn about the deep cervical fascia today. I've already done a lecture on deep cervical fascia 1, in which I've covered the introduction and I've spoken about the investing layer of deep cervical fascia. Today we're going to talk about pretracheal fascia, prevertebral fascia, and the carotid sheath. Okay, but of course, when I start the lecture, I'll give you a little brief about the earlier lecture too, so that those who have not attended the earlier one can also understand. However, my advice to all of you would be, do see the first lecture too. The link for it is given in the description section. So let's begin. Okay, before that, one little request from my side. Whenever you sit for my classes, please sit with color pencils and drawing sheets and maybe some, or maybe any digital drawing implement, iPads and whatever else. Okay. But when I ask you to draw, I expect you to draw. Not because I get some great enjoyment out of making you draw. It's because when we draw while studying, okay, you're using both sides of your brain. So what happens is this results in more cortex getting utilized for process of learning, resulting in better understanding and also better recall. Okay, so I hope you're going to follow my instructions and let's spend the next 20 minutes enjoying ourselves learning. Okay, so here you're seeing a human male and I'm going to take a section of his neck and this is what you see. Okay, so what you're seeing is the skin, superficial fascia and the deep fascia. Okay, so you can see the deep cervical fascia seems to be having a lot of layers coming in. Okay, these layers are from outside inwards, investing layer that encloses your neck, a pretracheal layer, and then inner to that, a prevertebral layer. You must be thinking, madam, we really can't relate to what you're saying. Yes, you will relate when you look at it in an image. Come on, let's come and take a look at the image now. Here you are seeing the same section with the deep cervical fascia covered on the outside by superficial fascia and the skin. Let's remove the skin and superficial fascia. There it's gone. And let's now focus only on the deep cervical fascia. As you can see, the deep cervical fascia has an outer layer called the investing layer. It gives rise to two processes. One that goes in front of the trachea, enclosing the thyroid gland, called the pretracheal layer. And one that goes behind, enclosing all structures around your cervical vertebra, called the prevertebral layer. So, deep cervical fascia has three layers: investing layer, pretracheal layer, and the prevertebral layer. I hope you've got this. But you would get it way better were you to draw with me. So let's begin our first diagram, students. Please get your color pencils out and whatever else. Okay, and let's begin our first diagram. Okay, come on. Okay, students, if you're ready, please begin your drawing by drawing your cervical vertebra. From your cervical vertebra, draw the transverse processes. Bring them back. Form the bifid spine. In the center, the canal, and here is the foramen transverse area. Take it back and now draw the ligamentum nuchae. Before we go any further, I'm going to add two muscles to it. Here is the trapezius muscle and here is the sternocleidomastoid muscle. Now let's see what the deep fascia does. The deep fascia now gets attached to ligamentum nuchae and begins to travel laterally. As it travels laterally, it meets with the trapezius, which it splits to enclose. Please, students, draw every little detail that I am drawing. Remember, this is relevant. Okay. Now take the layer further travels forwards, again coming across the sternocleidomastoid, which it again splits to enclose. Now the investing layer meets its fellow of the opposite side, completely enclosing the neck, as you can see. To understand today's topic, which is pretracheal fascia and prevertebral fascia, we need to add the trachea here. So please add the trachea, students. Now add the esophagus, dear students. See, enjoy the process of drawing. Please don't draw it just because I'm asking you to. Draw it because you're learning something. Now come to the investing layer of deep cervical fascia that is enclosing the sternocleidomastoid here. See how it travels inwards, traveling forwards to form the anterior layer of carotid sheath. Now it travels in front of the trachea. As it does so, it splits into two layers. Okay, these layers enclose a space that contains your favorite gland. Which is your favorite gland, students? Of course, it's the thyroid gland. So it splits to enclose the thyroid gland. So this layer that has passed in front of trachea and thyroid is called as the pretracheal layer. As you can see, it has formed the anterior layer of carotid sheath. Let us now go back to the same point on sternocleidomastoid where the pretracheal layer started. This time, take the layer backwards. It forms the posterior layer of carotid sheath and then travels medially to meet its fellow of the opposite side. It also gives rise to a fascial projection which travels backwards, completely enclosing the cervical vertebra and the space around it. This layer is called as the prevertebral layer. Take a little time out, pick up your lovely red color pencil and now draw your carotid artery medially. Take a blue pencil and draw your internal jugular vein laterally. Be smart and pick up in yellow colored pencil and draw your vagus nerve in between the two posteriorly. There you have your carotid sheath contents as well. Right, that completes our diagram. Let's revise quickly. Okay, so this outer layer which split to enclose the trapezius and the sternocleidomastoid is the investing layer of deep cervical fascia. It gives rise to a projection inwards that forms the anterior layer of carotid sheath, then splits to enclose the thyroid gland. This layer is called as the pretracheal layer. A similar layer that goes backwards, forming the posterior layer of carotid sheath and then enclosing all structures around the cervical vertebra. This layer is called as the prevertebral layer. Okay, so you've got your pretracheal layer passing in front of trachea, forming the anterior layer of carotid sheath. You've got your prevertebral layer forming the posterior layer of carotid sheath and enclosing all structures around the cervical vertebra. Let's come back to the screen now, students. Keep this diagram ready with you. You will refer to it throughout the class as and when required to get a better orientation of what I'm teaching you. Right. Keep away your color pencils and notebooks and let's come back to the presentation now. Right, students. So you saw how the pretracheal fascia and the prevertebral fascia are processes coming from the investing layer of deep cervical fascia. Okay, put that in your brain now. Maybe have a sip of water or some coffee like me. I'm always having coffee. Okay, and then let's begin to learn a little bit about pretracheal fascia, a little bit about prevertebral fascia. All right? Okay, let's begin. So that here, we are looking at the pretracheal fascia, which is a process coming inwards from the investing layer of deep cervical fascia enclosing the sternocleidomastoid. Okay, it travels forwards forming the anterior layer of carotid sheath. Then it moves forward splitting to enclose the thyroid gland. This layer is called as the pretracheal layer. Put it in your brain. Okay, let's learn a little bit more about the pretracheal fascia. The pretracheal fascia anteriorly is very tough. Posteriorly, it's comparatively flimsy. You must be thinking, how does it matter? Of course it matters, students. What happens is, when there's an enlargement of thyroid gland, which is something that happens quite often, I'm sure you've seen many cases of it. So it begins to travel posteriorly. What structure does it encounter? It encounters the esophagus. So it now begins to compress the esophagus. What will happen if it compresses the esophagus? What will happen if somebody compresses your esophagus? You will feel a difficulty in swallowing. Dysphagia. Okay? Right. So that is the importance of inner layer of pretracheal fascia. Also, you will observe that the inner layer of pretracheal fascia is thickening to form two ligaments called ligament of Berry. Say it once, please. Ligament of Berry. This ligament of Berry attaches your pretracheal fascia to your cricoid cartilage. Now pause, lift up your hand, hold your larynx. Okay, now swallow. Did you feel your larynx move up and down with deglutition? Yes? So now this is what is happening. Every time you swallow, your larynx moves up and down, carrying with it the ligament of Berry, which is attached to it. What is attached to ligament of Berry? Your pretracheal fascia, which is enclosing your thyroid gland. So now what will happen? Your entire thyroid gland will move up and down with deglutition. Again, you will wonder, why is she giving us so many details? What's the point? The point is that when a patient comes to you with a swelling in the neck, you're wondering, this looks like a thyroid swelling. Is it the thyroid swelling? What you do is, you hold the swelling and ask the patient to swallow. If it moves up and down with deglutition, then you know it is likely to be a thyroid swelling. You got it? This is how anatomy helps you in your understanding of clinical. Okay, right. So, thyroid moves up and down with deglutition. You understood why. You also understood the significance of knowing this. Let's go forward now. What is the upper attachment and lower attachment of this fascia? The pretracheal fascia is attached to hyoid and the thyroid cartilage. Inferiorly goes on to split to enclose the thyroid gland, which we just saw, and then is attached to the pericardium. With this, we complete the pretracheal fascia. Just see if you can remember what all we've done. We've talked about how it forms the anterior wall of carotid sheath, how it splits to enclose the thyroid gland, how its anterior wall is thick, its posterior wall is flimsy, it can grow backwards to compress esophagus, causing dysphagia. It is thickened to form ligament of Berry, because of which your thyroid gland moves up and down with deglutition. Carry this forward and let's come to prevertebral fascia now. Prevertebral fascia, as you know, is an inward projection from the fascia covering sternocleidomastoid. It forms the posterior wall of carotid sheath. This layer, which is prevertebral fascia, now gives rise to a fascial process backwards that encloses all structures around your cervical vertebra. Let's learn a little bit more about it. Here's your prevertebral fascia. You can see how it is covering the following muscles: scalenus anterior, scalenus medius, scalenus posterior, levator scapulae, and many others. I'm not going to point out all of them. Do they look familiar to you? Do they sound familiar to you? Good, I'm glad that they are familiar to you. We'll talk about this subsequently. Okay. Now here you're seeing a pink color blob appearing, right? So this is this space, which is bound posteriorly by trapezius, anteriorly by sternocleidomastoid, is called as the posterior triangle. Bound anteriorly by sternocleidomastoid, posteriorly by trapezius. This space is your posterior triangle, the roof of which is formed by investing layer of deep cervical fascia. Okay, and the floor of it is formed by, you can see the floor here. What is this floor, students? It's the prevertebral fascia covering all these muscles that I told you about. Now, if you've been studying the posterior triangle, you will recall muscles forming the floor of posterior triangle were these very muscles covered by prevertebral fascia. So what's the lesson we've learned? Prevertebral fascia forms the floor of posterior triangle. Also understand that this prevertebral fascia travels forwards into your upper limb in the form of a projectile sheath, which is called as axillary sheath. Okay, now see what happens is, from your cervical vertebra here, your brachial plexus is descending down into your upper limb. So is your subclavian artery continuing down as the axillary artery. As they travel down, let's take a look at this image. As they travel down, they carry a projection of prevertebral fascia downwards called as the axillary sheath. Now again you are wondering, why is she teaching us so much? What's the point? The point here is that when you have a caries in your cervical vertebrae, okay, there is pus formation. Where will it go? It finds this axillary sheath, right? So it begins to drag down along the sheath. And you have symptoms in your upper limb. You might have patients saying, I have pain in my axilla, okay? And then you have not been studying. So what do? You begin to, explore the patient's axillary region. But if you've been studying anatomy, you know that the infection is probably in the cervical vertebrae. And therefore, you would do the right investigations or the right examination to come to the correct diagnosis early. So, knowledge of anatomy takes you to the correct diagnosis early. Okay? Right. So, if you trace this prevertebral fascia upwards, you find that it's attached to the base of sphenoid and descends downwards in the form of an anterior and posterior layer into the thorax. Okay, so you can imagine that any infection in this layer could also track down into your thorax. Okay, let's talk a little bit of applied now. If there really was a caries of the vertebrae, it would come forward in the form of a median abscess which would project into the posterior wall of pharynx. Or it may travel down where? Can you answer this now? Of course, it can travel down into your axillary sheath, which is what we discussed a minute back. So that completes our discussion on pretracheal fascia and prevertebral fascia. What is left now? The carotid sheath. Now you can see a whole lot of words written here. Okay, and I'm going to tell you that I'm going to cover carotid sheath under the following headings. It's not very inspiring. What is inspiring is another diagram which will teach you most of what is expected to be known about carotid sheath. You will just need a couple of sentences to complete your knowledge. Alright, so let's begin the second diagram. Come on students, get your color pencils and drawing books back. I hope you're ready now students. Let's begin by drawing first the internal carotid artery. Remember, all your drawing must be neat and tidy with you telling yourself what you're doing. Don't just draw because I'm drawing. Draw with understanding. Okay, so here first I'm drawing the internal carotid artery. See how thick-walled it is because it's an artery. Take it down. Okay. At one point you can see the external carotid passing away out. Okay, draw that. With a slight dilatation now draw your common carotid. If you're smart, you would also color this off then and there so that you have the pleasure of drawing, okay? Right, now take a blue colored pen, okay? And begin to draw the internal jugular vein. Remember, this is internal jugular vein. It's a vein, so it will be thin-walled. So draw it so that the lumen is not exactly round, okay? Draw it down up till here, ensuring that your diagrams reflect the fact that it's not a thick-walled structure. Now, in between the two, take your yellow pencil and draw the beautiful vagus nerve. Okay, so you've got carotids on one side, jugular vein on the other, and in the center, the vagus. Now pick up I would prefer if you picked up a green colored pencil, and now draw the topic which we are discussing, the carotid sheath. Enjoy yourself, students. Enjoy the process that you're getting a little break from endless studies. Draw it with enjoyment. As you're drawing the carotid sheath, you find that you have to take a little pause to allow the exit of external carotid artery. Take it further down on both the sides and complete your drawing of the carotid sheath in a way that it at least appears plausible. Don't draw bad diagrams. It's not pleasant. It doesn't build a good image in your brain. We are going to now label these. Okay, so here label below the common carotid artery, here exiting from carotid sheath, the external carotid artery, going left over, passing upwards, internal carotid artery. Here's your internal jugular vein, the vagus nerve. Let's now take a section of this and draw another diagram of the section. Okay, ensure that whatever you draw is thick-walled on the medial side. Why is it thick-walled? I'll tell you why later. Just draw it. Wherever it is thick-walled on the medial side, ensure you draw a nice thick-walled carotid artery. Medial to that, you draw your, again, somewhat not exactly round, your internal jugular vein, okay? And in between them, posteriorly, draw your vagus nerve, okay? With this diagram in place, let's come back to the screen and you will be surprised at how easily you understand the topic of carotid sheath, okay? So you got this now. Let's come back to the screen and continue our discussion on carotid sheath, okay? Right. So the topic we're discussing is carotid sheath. First thing I've always told my students is introduce the topic to yourself. What is this I'm trying to learn? Don't just read just because you have some godforsaken timeline in which you have to finish studies. There's no point in this kind of studies. Think about it. I'm talking about carotid sheath. How would I define it? It's a condensation of connective tissue. Yes. Around the great blood vessels, nothing can be greater than internal jugular and common carotid, isn't it? Okay. In the form of a tubular sheath called as carotid sheath. Does that make sense to you? Come. So, it's a condensation of connective tissue around the great vessels in the form of a tubular sheath called as carotid sheath. I think for me, this definition definitely works. See if it works for you. Right. So how is it formed and what are its attachments? It's formed, I think now, I'm not going to tell you. Do you remember how it's formed? Anteriorly by whom? Posteriorly by whom? Anteriorly by pretracheal fascia. Posteriorly by prevertebral fascia. You remember we've done all this. So always build on what you know and then take it forward. Don't unnecessarily mug up. You will stop having faith in yourself. We know the anterior layer is formed by pretracheal fascia, posterior layer is formed by prevertebral fascia. Superiorly, it is attached to the base of skull. Inferiorly, it's attached to the adventitia of aorta. Okay, so that covers its attachments. What does it contain? Now, do I have to tell you that? We already know it. It contains in the lower part the common carotid artery, the internal jugular vein, and the vagus nerve. Okay. In a section, you can see how the common carotid artery is medially, the internal jugular vein is laterally, and the vagus nerve is posteriorly. At one point, at the level of lamina of thyroid cartilage, the external carotid artery leaves the carotid sheath. And what is left is the internal carotid artery along with the vagus and internal jugular vein. So now the question is, if external carotid artery pierces the sheath, is there anybody else who pierces the sheath? Let's take a look. Structures piercing the sheath are: 1, external carotid artery; 2, if there is a vein, what should also be there? Tributaries of the vein. So yes, there are tributaries of internal jugular vein and branches of 9th, 10th, 11th, 12th cranial nerves. All these are structures that pierce the sheath. Okay. Let's talk about thickness. You remember we had a little talk on thickness when we were doing the diagrams. As you can see here, it's quite medially thickened, okay, and laterally it is somewhat flimsy. It is medially thickened because it's enclosing the common carotid artery, okay, surrounding it, giving it good support. It's laterally thin because there is always a chance of increased venous return in case of veins. So to allow for the venous expansion in case of increased venous return, you have to have that thin cover on that side. Okay, so that's the reason for the thickness and the thinness. As you can see anteriorly, there are 2 tiny yellow dots. These are the dots indicating presence of ansa cervicalis. And posteriorly, you can see the presence of cervical sympathetic chain. So these are the anterior and posterior relations of the carotid sheath. Finally, we come to the applied anatomy. Here, this I find extremely interesting. I hope you do too. See students, what happens is there is a procedure wherein lymph nodes of your head neck region are removed. Whenever there is a metastasis, it happens in the metastasis spreads out in the lymph nodes in your neck region, so that this may need us to remove these lymph nodes by a procedure called block dissection of the neck. Okay. So when you're removing these lymph nodes, they may become adherent also to the surrounding structures, And this way you'll end up exposing the carotid sheath. Now, I don't have the time, nor this is not the time to discuss block dissection of neck. But in one of my subsequent lectures, there is a little 2-minute discussion on block dissection of the neck, which gives you an idea of why you should know the anatomy of the neck from surgical point of view. So do read up upon this. You will find yourself really surprised at the kind of surgeries that take place. See if you like it, do read. Right. So now we complete the topic of carotid sheath, and now let's take a look at these points that are displayed here. Can you define the carotid sheath? Remember, I told you how to define it. It's a connective tissue sheath enclosing the great vessels of the neck in the form of a tube called as carotid sheath. Then we talked about how it is formed. Okay, then we talked about its attachments, contents in the lower part common carotid, in the upper part internal jugular, internal carotid artery along with internal jugular vein and vagus nerve. Then we spoke about structures piercing it, anterior relation of ansa cervicalis, posterior relation of the sympathetic chain. We talked about the thickness and applied anatomy of block dissection of the neck. Now, students, there are a couple of questions here which I would love you to attempt. If you need any help, you can always message to me and we can discuss that. For those who are really interested or inspired, which I hope you are, I request you to explore the topics of retropharyngeal space and lateral pharyngeal space. These are of great clinical relevance beyond the purview of my today's lecture. Subsequently, I will be putting up small lectures on this, but that will be some time from now. So please do read up, and I am of course available. You can give me a call and we can discuss this. These are some MCQ students which I am confident that you will be able to solve. More such MCQs are available on my website. You can always go there and practice MCQ solving. Okay. So there are also these diagrams which are there throughout today's lecture. I want you to go back to these diagrams and just quickly run through to revise. Sometimes you're so short of time. Just use these diagrams to revise. You'll be surprised at how much you already know. For example, here you are seeing the investing layer of deep cervical fascia enclosing the trapezius and sternocleidomastoid, forming the anterior and posterior wall of carotid sheath, anteriorly enclosing thyroid gland forming pretracheal fascia, posteriorly enclosing structures around cervical vertebra forming prevertebral fascia. Again, here you are seeing similar diagrams as per the carotid sheath. Revise these to draw when you don't have time to read theory. Okay? So with this, we come to the end of my lecture on deep cervical fascia part 2. My request to all of you is please keep drawing. It will help you to learn a lot. It will give you more confidence as you realize that your recall is way better. With this, we come to the end of my lecture, students. As a teacher, it's my job to advise you. So today my advice is, don't let what you cannot do interfere with what you can do. Sometimes you just can't read a book. You feel I can't do this. This is too much. Okay? Then what can you do? You can go online. You can see videos. I'm not saying don't just see my videos. No. But you have this avenue of studying today. Use that. Use drawings. But don't let what you cannot do stop you from doing what you can do. I hope I'm making myself clear. Just keep doing every day a little bit. Okay? Alright, so with this I end my lecture. I had a great time taking this class with you. I hope you enjoyed it too. See you across the screen in some other lecture. Till then, keep studying, keep drawing, and keep learning. Thank you.